Welcome to the podcast, The Dental Breakdown. My name is Christian White. I'm the CEO and owner of White & Associates Practice Consulting, Better Business, Better Dentistry. Today's podcast is focusing on the private dentist's success and helping them to navigate the troubled waters of the coronavirus. We are a ray of hope in a cloud of uncertainty today. And to help the private dentist to get through these troubled waters, I have brought in the best dental talent in the dental marketplace today. These people are unparalleled in what they've been able to do for their clients and helping the private dentist to be successful. So let's go ahead and have them introduce themselves. Lisa, let's start with you.
Hey Christian, I'm Lisa Netzer and I'm an attorney working with Minnesota Transitions, a law firm that specializes in dental transitions and helping dentists with all their legal needs. I'm an attorney who brings a number of years of employment law experience with me to the firm, and I have been working with Joe Frickin now for 2 years.
Wonderful. All right, Dr. Frank, why don't you go next, please?
Frank Milner, dentist for 43 years. Enjoyed every minute of it. I am a clinician. I'm a educator and publisher, and most recently a clinical mentor for dental schools across the country, DSOs, clinical mentoring to find solutions for the dentists for materials and etc. I am a byproduct of my mentors, so I bring passion to the table, and it's a pleasure to be with this panel today.
Thank you, Frank. Joe, let's go to you next, please.
Thanks, Christian. My name is Joe Frickin. I'm an attorney, and I started Minnesota Transitions with Dr. Dave Lindy. And as Lisa said, we help dentists throughout the transition process, buying into a practice, selling a practice, joining a partnership, leaving a partnership, as well as supporting all the legal needs surrounding all of those transitions.
All right, thanks, Joe. And last but certainly not least, Mr. Jay White.
Thank you, Christian. Well, everyone, I work with White & Associates Practice Consulting with my son, Christian, and I've been doing this for the last 40 years. And Frank, we have seen lots of changes in dentistry, but basically we work with the business side of the office as well as how to handle staff issues, complaints, and how to grow the practice. And little bubble we're having right now is a pretty big bubble, and it's a good thing that we're having this discussion because I think it's good ideas that we need to talk about.
Yeah, it's going to be a real humdinger of a discussion today, let me tell you. I'm going to turn the conversation over to Joe Frickin, and we have right now currently being debated is the stimulus I think it is $2 trillion stimulus package that's being debated right now, and how's that going to affect the private dentist, especially for dentists who've laid off all their staff. And Joe's going to kind of give us the in and outs of that today. So, Joe, please take it away.
Well, thank you, Christian. So the Congress is in the process of putting together support and bailouts for the country. And on Thursday, March 26th, the Senate passed the CARES Act. Today, Friday, March 27th, it is going to be voted on by the House and then hopefully signed by the President. But we're not expecting any changes to it. So we're trying to get as much information out to practicing dentists and their dental practices as soon as possible so they can start planning. Mm-hmm. Because there are a number of items in this bill they'll be very helpful for dental practices. And it is slightly changed from what was previously proposed about a week ago. So the CARES Act, on an individual level, money is going to be going out to individuals. There are income caps on that, but you can check the amounts are not significant as far as impacting a dental practice and keeping it going. But the small business loans that were proposed and are included in the Senate bill are going to be hopefully very helpful for keeping dental practices going and making sure that they're going to be businesses, they're going to be open and supporting their patients, treating their patients going forward. So So some of the details on this bill are that it's going to be an SBA loan, a 7A loan, and you can get the loan for up to $10 million or 250% of the total monthly payroll for you. So there are some caps on that, but the whole idea is to make sure these loans are going to be used for paying off and paying your payroll for your staff. So you get the loan, and then it is going to be, the whole idea is it's cancelable or forgivable up to 2 months of payroll and all the expenses that surround that, 2 months of rent, and 2 months of your utilities.
Wow.
And the way it works is you get the loan, and then at the end of those 2 months, after the origination date of the loan, you can provide the bank with information about all of your expenditures for payroll, rent, and utilities, and then the federal government will pay off the loan for those expenses. Now, if you take a loan for higher than those expenses, that loan still will need to be paid off, but there are no payments for the first 6 months of the loan. There's still going to be interest that will be accruing, but you won't have to make any payments on that. The one piece that is kind of been, I think it's been a little unclear throughout this process since it was proposed about a month ago, is that the amount that's forgiven is reduced based on the number of employees that have filed for unemployment. And a number of dental practices in the last 2 weeks have laid off and asked their employees to reduce their hours, reduce their income, and they filed for unemployment, which is the right thing to do because they need a paycheck to pay their expenses, and there's really no work to be done with the offices closed. So what the bill provides is that as long as you hire your staff back to your pre-existing levels of staffing levels and provide them the same salary, then you're not going to be impacted by the reduction in the forgiveness. So I'll repeat that. As long as you hire your staff back to levels that, before the coronavirus and the closures, as long as you hire your staff back to those same levels, the number of staff members, and back to the same salary levels, then you will not have any reduction in the forgiveness. So then you'll have the full 2 months of payroll, 2 months of rent, and 2 months of utility payments that are going to be forgivable under the loan. A couple other highlights to it are that the amount that's forgiven, typically when a loan is forgiven, that's considered income to the borrower.
Mm-hmm.
But under the CARES Act, this is not going to be considered income, so you're not going to be taxed on this forgiveness, which is definitely, it's great that they're thinking about that. What we're telling this still isn't law yet as of the recording of this podcast,
Mm-hmm.
but we are telling our clients to talk to their bankers as soon as possible, start collecting any information that's going to be needed. The bank that you work with is kind of they're going to be the person who's the entity that's going to manage the loan and that's going to help with the application process. So you should talk to your banker to help with that. And if you don't have someone to call, please reach out to us. We can definitely connect you with people that can help with the process. The bank is going to be the one that you're going to provide all the information, all the documentation for your 2 months of payroll, rent, and utilities. And so what I encourage you as you're going through this process to be very vigilant about keeping documentation about your expenses that's going to be forgiven, so you can provide that documentation to the banker. Because the SBA is going to be Small Business Administration is going to be working with the banks here, the banker is going to have the best information for what you need to apply for the loan, and any other questions you may have about the forgiveness piece and what you're eligible for. So we would encourage you to talk to whomever it is at the bank to help through that process. The other main piece that is going on from a support is, in an earlier podcast, I had talked about loans through the state of Minnesota, through the deed. And at that time, earlier in the week when we were recording, it was a little unclear whether or not dental practices would be eligible for those loans, which were 0% interest and potentially 50% of the loan being cancelable. As of I would still say it's a little unclear, but it appears that dental practices, as of the date of this podcast, are not eligible to apply for that. And the Minnesota Dental Association is asking dentists to reach out to the governor's office, reach out to their legislators to ask them for dental practices to be included in those loans, given that they're ordered to be closed by the governor. Right now, the executive order talks about restaurants, bars, gyms, those types of businesses. They were also ordered closed, but dental offices are ordered closed too. So the Minnesota Dental Association is working hard on asking all dentists to call the governor to ask them to be included for those loans. So, that's about, that's the extent of the CARES Act and the DEED Act. There are other disaster relief loans that are available through SBA. Those don't have as attractive forgiveness provisions as what's in the CARES Act, but certainly, talk to your advisors, talk to your bank to see what the best option for you is.
Wow, Joe, that's pretty important. This coronavirus is something that nobody has ever been through this before. So for the government to be able to make this available and have something available for dentists, that's unheard of.
Yeah, definitely.
It really is.
And one more piece. There is, Congress appropriated $350 billion to this program, and it's anyone's guess how far that $350 billion is going to go. So we encourage you to, if you're going to seek and try to get this loan, is to work on it now, soon later.
We're losing them. Joe, can you hear us?
Okay.
I can hear you. Yes.
All right. We lost your video there for a little bit. Can you repeat yourself?
Okay.
Oh, I just said that the Congress appropriated $350 billion to this program, and we don't know how far that loan is going to go or how far those funds are going to go. So if you are going to apply for the program, you should do sooner rather than later. And I know Lisa's got a couple things to add on the hiring back if needed.
Yeah, we've gotten a lot of questions from dental offices about bringing people back after the closure orders are done. I would like to first say that for people who are staying open, because I have heard from a couple of dental offices who have used special projects or other work to keep their employees on their payroll right now. If you are still open and doing things besides servicing your patients or just providing emergency care, you are definitely eligible for loans that are for ongoing businesses. And you should definitely look into those, because that's another possibility through the Minnesota Employment and Economic Development or Minnesota DEED Department. And those are important. We talked before in another podcast about making sure old records are cleaned up. Maybe you want to update how your dental office reaches out to patients. Maybe you need to upgrade some software. All those sorts of things are great things for your staff to come in and do during this closure time. So I do know of a couple of places out there that have called me and asked, well, if we're open, do we have to pay sick leave? Do we need to pay other things like that? For offices that are closed because there's no work, you do not need to pay personal time off, sick leave, or vacation. But if you are open, you're going to face some of those questions, and it depends on what your employment handbook says and what your policy is for those employees. So keep that in mind, that if you're open, it's great to be open. It's great to keep the business going. It's great to do some upgrades right now if you can. Just know that if you have employees who become sick or have to care for someone who's sick during that time, you would also pay them sick leave if that is one of your benefits. One other question that came up for employers who have people out on unemployment is about COBRA coverage. Some dentists, admittedly few, but some dentists do pay a portion of the medical premium for their employees. And if they're not earning, if they are temporarily laid off, they are subject to the COBRA provisions. So it's a time when I know a vast majority of staff usually take benefits through their spouse, but that's not always the case. So if you're one of those employers who's been generously offering insurance premiums, please work with your insurance agent to get out information about COBRA coverage. And I would also mention to everyone that if you know that some of your employees are not insured, it is right now is the time for open enrollment through MNsure. So if you have employees who are, maybe that front desk person who comes in once a day and maybe isn't 65 yet, so doesn't qualify for Medicare, please encourage them to consider coverage through MNsure. And the MNsure website is mnsure.org. And this is a COVID-19 opening that the governor has declared. Take advantage of it if you can. So what about bringing employees back after you've reopened? Let's say we're a few weeks from now and we're going to go ahead and start seeing patients again, start bringing people back in off of unemployment. You need to be thinking about how you re-up your staff. We don't anticipate that people will simply be busy at the turn of a button, nor that all your patients will show up, because according to the government data, we're 14 weeks away from having the biggest impact from this virus. So we're going to have people who are sick, we're going to have people who are getting sick over the next couple of months. So how do you either ramp up or deal with absences while when you're open again? I wanted to let you know that if you are slowly opening up, let's say you're doing emergency care only and you just need someone to come, say a dental assistant comes in once a week, that hourly rate will decrease that person's benefits under unemployment, but it's up to them to report it to the state so that they know how much money someone is actually making per week. For a lot of people, though, doing a few hours of work is more lucrative than their unemployment benefits. So getting hours in generally is going to be better for most people. I just would encourage dentists not to try to spread it around too thinly, because you might end up affecting a lot of people's unemployment benefits if you do that. So the best thing to do always with your staff is to consider what are the skills that you need right now. So if you're doing emergency treatment and you've got someone who's really good at very quick work, maybe that's the person you're going to bring in to do emergency treatment work with you. When you open your office again, if you don't have a full schedule, what kind of skills do you need in your office at that time? And if you make decisions about your staff that is based on that kind of analysis, you're going to avoid discrimination claims. And the reason I bring that up is because some dentists have talked about wanting to bring in people who are younger because they're less likely to be sick from the virus, or avoiding somebody who has chronic health conditions. Both of that tend to exclude people who are older. And if you're over 40, you are protected from age discrimination. And so if you exclude half your staff and they all happen to be at that higher end of the age range, you might be looking at a discrimination claim. I've also gotten questions about what does it mean to bring your staff back? Sometimes people are tempted to deal with poor staff by simply not hiring them back after a layoff. And like I said, if you are bringing in your best people first, that's a perfectly good business reason to hire someone over or bring someone in before someone else. But you have to be careful that the person you're not bringing back because maybe their performance isn't great is not a person who would be in a protected minority group. So were they the only male who didn't get hired back? Were they the only person of a religious minority who didn't get hired back? Were they the only person not born in the United States who didn't get hired back? So if you're doing some thinning, it's always good to get rid of your worst performers, but don't walk yourself into a discrimination claim by doing so. So, and the other thing I would encourage many dental offices to think about is that we do have these numbers and modeling out there that tells us that we are not done with this wave of COVID-19, even after the 2-week mandatory stay in place order from Governor Walz. The modeling he showed in his press conference the other day showed that we're 14 weeks out from the worst of the outbreak. So keep in mind that if you provide sick leave, if you provide paid time off, if some people might need to use vacation time because they're home dealing with the sickness. Even though we are generally talking about offices that aren't subject to Family Medical Leave Act or the paid leave provisions that were recently passed by Congress, you're going to have to deal with that. And so how are you going to deal with how much time off you allow people to take, and how are you going to deal with it if you have many requests at once to stay home? So some people right now is a great time to look at your employee handbook and make sure you know what your own employee handbook says. You want to keep that in mind, and you want to make sure that you apply it evenly. Let's say your handbook just gives you flexibility to give people time off as they need it, and that's your plan, that's fine. But don't be saying yes to one employee and then no to another. You need to treat everybody the same, or generally the same. I'm not saying you can't make exceptions or things as you go along, but if for some reason you treat one group of employees differently than another, you better have a business reason for doing so.
Mm-hmm. Okay, thank you, Lisa. That was really great. In terms of an employee handbook, Lisa, if a dentist has a question about a handbook, or is that something that they can come to you with?
Absolutely. We do review handbooks. Sometimes people inherit handbooks that they haven't really looked at since they've purchased a practice. And sometimes there's some really surprising provisions in there.
Mm-hmm.
Some dentists just wanted to kind of throw everything in there from the kitchen sink. I've seen practices as small as 8 employees where they've elected to allow coverage similar to the Family Medical Leave Act in that employee handbook. And that's the rule of your workplace if that's what you got. So know what you have. If you need an update, come talk to me. Or
Okay.
if you don't have anything in place right now, I'm happy to talk to you about getting at least a policy in place, if not a firm handbook.
Okay, wonderful. Thank you very much, Lisa. Joe,
Yep.
let me come back to you real quick. In terms of the reimbursement money for the dentists from this stimulus package, if I have, a staff, and if I think you said you had to hire 90% of them back. Please correct me if I'm wrong on that.
Yeah, I would, as far as the specifics of the amount they need to hire back, definitely talk to the banker, to the
Okay.
bank about it. It's going to get information from SBA.
Okay. Because my only thought was if I'm going to hire a good chunk of my staff back, but what happens if a good chunk of them are at home sick? How does that affect my reimbursement rate with this plan then? Because I'd like to hire everybody back, but I mean, I can't because they're at home with the virus. Do you have any insight on that?
As long as you're, the whole idea is that you're going to be, you're keeping them off of unemployment. So you're going to be paying their payroll.
Okay.
And so you're probably, even if they're home sick, hiring them and paying them something is going to be worth it, because the government, the loan that you're going to be getting from from SBA, the SBA loan is going to be forgiven. So you're not going to owe anything of it. But as far as like some of those specifics, we should definitely talk to, we're going to get more guidelines from SBA to see, how some of those specifics will kind of play out.
Okay.
And Christian, it also speaks to the idea of paid sick leave, because if someone's hired back formally and they're entitled to paid sick leave, technically their paid sick leave would be paid by the loan, which is a pretty good deal. It's actually kind of the paid sick leave that Congress was trying to get in place with the other legislation they passed, although it appears that they will make an exception for employers with 50 employees and under. So it's a great time to consider what your sick leave package is for your employees at this point.
Okay, great. for all the dentists out there and for all the listeners of our program, you know, I guess take a look at your employee handbook. I'm hoping it's not downstairs in the basement with a lot of dust on it. If it is, and if you do have a lot of questions, please give Lisa a call because she'll be able to take care of it for you. Moving right along, you know, Jay, I want to come to you now. So Lisa said that, and Joe said, you know, you're going to hire your staff back. So you're a dentist, Jay, you know, the staff have been off for a while, and now here come the staff back into the office. So, you know, what are some things that we could do with the staff to keep it so it's time well spent that's productive, even though we may not be seeing patients?
Well, it's a good question. If you're not seeing patients and there's got staff in the office, this is a great time to work on the business and developing it and working on the areas that are weak. We talked about this at the last podcast. The ins and outs of the accounts receivable, the ins and outs of getting delinquent recall people lined up to get back in, the ins and outs of, you know, training staff a little bit more thoroughly than where they have been, or areas where there needs to be some skills that are honed, would be very good time spent here.
Mm-hmm. Okay. Frank, let me come to you. You know, in the world of dentistry, I don't think there's anything you have not seen or experienced or, you know, had to go through. I mean, you know, give me your 2 cents on all the stuff that's going on. And we got this bill that's going to get passed. We got money that's going to be given to dentists. You know, how is this going to affect the private dentist, you know, from an actual dentist who's actually out there, who's working?
Well, Jay and I have something in common. Our first crisis for me was in 8th grade. We hid under the desks in public school for the Cuban Missile Crisis. In case there was a nuclear war, we had to practice hiding under a wood desk. Okay, that was the first crisis I remember. The thing here I'm impressed with in this podcast is just like a patient coming in, they're not hiring you to do a crown. They're not hiring you to do a filling. They're hiring you for your expertise. And what I'm impressed with this panel is expertise. I just can't imagine a dentist not having assets like Joe and Lisa and Jay and Christian, perhaps me at the bottom, is you need to network right now. The thing I have seen with Jay's help throughout time, the biggest thing we wanted to do is be a cosmetic dentist and increase production and have bonuses and have refrigerator magnets for marketing and things like that. But this is the way, this one, you're not going to go back to the way things used to be. That there's got to be a change in the culture between the patients and the dentist. You got to understand how the patients are thinking. Here's the big one I'm going to drop on you, and this is real tough for dentists because I'm a dentist. We don't like to change, okay? We must deconstruct the traditional paradigms, how we used to be, how things used to be, because that's gone. Okay, this is the new normal right now. I think what's going to happen, like Lisa and Joe and Jay making comments, is we have to become compassionate dentists, not cosmetic dentists. We have to become compassionate, empathetic dentists. And I'll close by this. This is another thing that sometimes is a rarity in dental office. It's called leadership. And it all starts with leadership. Jay's seen it. You've seen it in offices. We're good at creating tooth dust and the factoids that we love to do. Shut the world off and just let us prepare teeth. That's what we like to do. But this requires a paradigm shift. This is a deconstruction. You have to tear down the old model of patient management into compassionate dentistry and healthy dentistry.
Great. Thank you very much, Frank. That was wonderful. Very well said on your part. You know, Joe and Lisa, I'm going to kind of come back to you. You know, As far as the documentation, Joe, that the SBA needs, can a doctor, you may or may not know this, can they just walk into their banker's office and hand them a P&L for the last couple of years? And will that be suffice for this, as far as in terms of expenses?
The volume doesn't work, Chris.
There we go.
Yep.
So I'd say that don't walk into a bank. Do it by email
Okay.
for social distancing. And but in general, from my conversation so far, it's going to be 3 years of financial statements and 3 years of corporate and business tax returns.
Okay.
There's also an application that needs to be filed that the banks can provide to you. But certainly detailed questions like that are best directed to the people who are going to be filing the application, and
Okay.
that's to your local banker.
Okay. All right. That sounds good. I just thought I'd just ask that real quick. All right. I think that this was a great discussion this morning. Lisa and Joe, you guys are awesome, and you are rock stars as usual. So you were right on point today with the great information. Joe, Frank, thank you very much for your commentary. That was wonderful as well. I think before we wrap this part of the podcast up, does anybody else have any closing remarks? Anything else they'd like to add?
I'd like to add a couple things here, Christian, if I could.
Go ahead, Jay.
I want to follow up on what Frank had to say because he's talking about compassionate dentistry and the new paradigm. And I want to say to you that there's a struggle going on that's becoming more important now than ever before between two words. And we all know the words and we struggle with them in our dental offices. It's a struggle between being efficient and being effective. Dental school, and we've all been trained to be efficient. When you're dealing with teeth, the dental assistant and the hygienist and the doctor have got to be efficient. But I think many times they forget that these teeth are attached to people when they're wheeling into the operatory. And the people have feelings. And don't forget that the people who come to your offices are usually, most of the time, it's a discretionary decision. And so how do they make the, and particularly now with the situation that we're in, okay? Going to a dental office is much like taking your spouse out for dinner. If you're treated efficiently, you'll never go back. It's not about the food, always. It's about something else. So that brings us to what Frank, I think, is talking about in this called experiential marketing. The experience of going to a dentist has got to be a good one or exceeding people's expectations. That means that each staff member who has an interchange with a patient becomes the dental office to that patient. What they do, what they say, or what they don't do, and what they don't say is seen and felt by the patient. I always have said that the patient coming into the dental office has a Mach 1 crap detector strapped to their belt, and women's more finely tuned than men's. And you better be aware of that because everyone is listening, everyone is watching. And what you do and what you don't do is part of the experience. They also, I think, important to know, it's also important to know that, you know, the product of a dental office is not that filling. It's, as Frank had said, it's not that white little thing that you've got in cement. The patient leaves with a feeling about the office, not a filling. And that feeling is not exclusively the dentist's. It's the person at the front desk, it's the person who's assisting, it's all, and they should be all trained to know that. It's becoming, and that will become more important today than ever before because we're in a new paradigm. It is not time to be efficient. This is not time to be efficient. If you do, you won't keep the patients with you.
All right. Thank you, Jay. That's some very insightful words.
Christian,
Well, go ahead, Frank.
I want to go back in the way back machine with Jay. Jay and I, our first the first time we had practiced social distancing was in 7th and 8th grade in the school gymnasium for the dance. The boys were on one side and the girls were on the other.
That's a fact. That's a fact. Yeah. Oh, we wouldn't dare go across that field.
Oh no!
Oh, that was scary. Things have changed, but now. we'll
Oh,
see.
yes. They text each
Okay.
other now.
Actually, that's pretty good social distancing. If we,
Oh, my.
all right. Thank you very much, everybody. This has been time well spent today. I think the information that we shared is awesome. It's going to really help the dentists, and it's going to help them keep their dental practices productive and profitable, and help them give a sense that, you know, somebody's out there looking out for them, and that would be us. So again, thank you very much for all of you being on the call today.
Thanks, Chris.
You're
Thanks.
welcome, everybody.
Thank you.
And to all of our listeners out there, what we're talking about and what we're sharing today should really, really resonate with you. We got 5 of us on here who are dedicated to the health of your practice. So if all of this is interesting to you, which it should be, please go to whitedentalconsulting.com/breakdown for more information, or call our office at 952-432-3322. We'll answer any question that you have. And if you do have a question for Joe or for Lisa or for Frank, I will make sure personally that they're contacted. Thank you very much, everybody. It's been great.